Hello, everyone. Today we'll be covering caffeine and nicotine. This is from chapter 6 uh, from your book, Julian's Primer of Drug Action. Does anybody out there know which is the most widely used psychoactive drug in the world? If you said caffeine, you are correct. Caffeine is considered a central nervous stimulant, meaning that it's an uplifter, and so it gives you energy and it makes you more like awake, uh, gives a feeling of arousal as well. And caffeine belongs to the xanthine family, which is a class of molecules. Caffeine occurs naturally in coffee beans, tea leaf, kola nut, and cocoa beans. It's also toxic to insects, birds, dogs, and cats. And so plants produce caffeine as an insect repellent. However, when humans consume it, it has a different side effect for us. It's more of a stimulant. And some people use their leftover ground coffee as a like a pesticide. And so I've actually tried it myself. I grow like aloe, and I have some cactus and all kinds of like different plants. And sometimes like spiders will get into them and put webs all over it, or insects will bite them. And so I've tried using coffee grounds and I put it like on top of the soil as an insect repeller. And so some people do that, and I don't know how effective it is. It was somewhat effective on my plants, but this is not uncommon. However, if you're going to do something like that, just make sure that your pets don't eat it or don't lick it because it's toxic to them. Some caffeine products that we can find in the store and easily purchase without like a prescription or without, it's not illegal, so you can easily obtain them. And so some of these caffeine products are found in soft drinks, um, candies, medications, energy drinks, caffeine mist. And so here's a picture of the different types of caffeine products and the concentration of caffeine in them. The FDA classifies caffeine as safe when up to 0.20 or 2% is contained in beverages. And so it's safe at 400 milligrams daily. However, when consumed excessively, it can cause adverse side effects. So let's talk about the pharmacokinetics of caffeine. And so this is how caffeine affects our bodies. And if you remember in previous lectures, we talked about ADME. And so ADME is the absorption of a drug, the distribution of a drug, the metabolism of a drug, and the excretion of it. And so let's start off with the absorption. And so first of all, caffeine is mostly consumed orally. And so you can eat it or you can drink it. And so if it's done that way, that means that it also goes through the GI tract. Caffeine easily and readily diffuses through our tissues in our GI tract. And so the GI absorbs about 99% in 45 minutes. And so it is quickly delivered to the body. And so how is it delivered to the body? So by distribution, it is equally distributed throughout the body and brain, meaning that it can easily cross the blood-brain barrier. And for a female that is pregnant, the caffeine can also easily distribute to the fetus. How is caffeine eliminated? So the elimination time is anywhere from 2.5 to 10 hours after consumption. It is shortened in smokers. So there's like an effect with smoking and caffeine. And so people who smoke tend to have a shortened effect of caffeine. However, in women that are pregnant, the caffeine tends to be prolonged depending on what trimester or depending on what trimester she is in her pregnancy. And so during the last trimester, caffeine tends to have like a longer side effect. And it's also known to contribute to cigarette withdrawal symptoms. And so there's a correlation between caffeine drinkers and cigarette smokers. Now let's talk about the metabolism of caffeine. And so this is still part of ADME. And so the metabolism in caffeine, if you can guess where it's metabolized, it is metabolized in the liver. And we had talked about this enzyme, the cytochrome P450, which is an enzyme that breaks down other drugs as well, such as alcohol. And so this one is also involved in breaking down caffeine. And so when caffeine is broken down, you end up with three metabolites. meaning that when it's broken down, you get other different types of molecules out of it. And when these molecules are synthesized from caffeine, they have different effects on the body. So, for example, paraxanthine, which is 84% of it, is formed by caffeine, breaks down fats and increases blood levels of glycerol and fats. And theobromine, which forms about 12%, dilates blood vessels and also has a diuretic effect. And so, a diuretic effect means that water is pushed out of the cells, and a person tends to urinate more frequently. So, I don't know if you've noticed that when you drink caffeine, that you have to use the restroom more often, but that's actually a side effect of caffeine because of this metabolite. And theophylline, which isn't formed as much by caffeine. And so, when caffeine is broken down, any of these three molecules can be made, but according to research, paraxanthine, this one right here, is made the most. Now, if theophylline is made, theophylline tends to dilate the airways, and this molecule is actually used in the treatment of asthma. And so dilation means that it basically opens up the vessels. And so if you open up the vessels, that means you can get more oxygen in. But for the most part, caffeine is mostly broken down to paraxanthine. And so this is most of the side effect that you get out of it. The way that caffeine is excreted is through the kidneys out the urine. And so when these metabolites, here that are broken down by the liver, are yet further broken down, and when they're no longer useful, then they are excreted through the kidneys and out the urine. There are genetic factors that control the metabolism of caffeine. And we have talked about this before with alcohol, where some people have a high alcohol tolerance and some people don't. And that depends on the liver and how quickly it breaks down that drug. And so this is the same case with caffeine. And so some people are rapid caffeine metabolizers, meaning that caffeine can be broken down 4 times as fast. And so the caffeine wouldn't last that much or that long in your body, and neither would the effects. And then there are slow caffeine metabolizers, which means that the caffeine exposure lasts a lot longer, and these people are more likely to be affected by side effects, for example, increases in heart attack and hypertension risks. There are beneficial effects of caffeine. It can be used to help with cardiovascular function. So, for example, it can lower cardiovascular disease and lower the calcium or the amount of calcium in coronary arteries, and even have been known to use as a headache relief, which I am also explaining over here. And the headache relief comes from blood vessels that often dilate during headache, and so caffeine tends to relax that. It can also be useful in overcoming sleep deprivation, and so it creates this sense of wakefulness and alertness, which then reduces sleep. For some people, it increases their physical performance, and so it gives them increased energy and reduced perception of muscle pain. You can actually find this in products that are used for exercising. Like I have a product that's called Lit AF, and that is like a pre-workout mix, and so you drink it, and it has some caffeine, and it gives you like this increase of energy. And it can also be used for cognition and mental health. For some people, it basically gives them better memory and more alertness. And it's believed to also be used for the reduction of development of Alzheimer's disease, although that's controversial. But it helps some people with Alzheimer's. And it's also been known to help with depression, fatigue, and memory. Caffeine can also produce negative side effects, especially when consumed too much. So heavy consumption is considered as 12 cups or more per day, or 1.5 grams of caffeine, depending on how the caffeine is consumed. And as a result, can cause agitation, anxiety, tremors, rapid breathing, and insomnia. And there's also such thing as a lethal dose, and that's when 10 grams are taken orally, and so that's equivalent to about 100 cups of coffee. And so death is a result of convulsions and respiratory collapse due to the high amount of caffeine. So far, 6 deaths have been reported due to high consumptions of caffeine. There's probably more deaths than that caused by caffeine, but these are like ones that are documented and reported. And continuing on to the adverse effects of caffeine, meaning the negative effects of caffeine, it can also have an effect on sleep. And so, if you've been taking caffeine for a prolonged amount of time, it may cause insomnia and it may impair the duration and the quality of sleep and cause repeated awakenings. So, you can awaken throughout the night. And I don't know if it's ever happened to you where you've taken caffeine to study for an exam. And I say that because that's happened to me. I'll take caffeine in the evening to study for an exam, and then I just can't sleep throughout the night. And so I myself have been affected by an adverse effect of caffeine. And some other consequences when combined with other drugs, such as energy drinks and alcohol, can increase the effects of alcohol. And it's been reported that when combined with other drugs, it increases sexually risky behaviors, marijuana use, fighting, prescription drug abuse, alcohol abuse, and cigarette smoking. Energy drinks, such as Red Bull, and there's lots of different types of energy drinks out there, have a caffeine content that may be categorized as natural, but it's not FDA regulated. And so the FDA is the Food and Drug Administration. And so when they don't regulate something, that means that you're basically consuming something at your own risk. And so that's the case for like a lot of vitamins. That's the case for like a lot of the over the counter type of supplements that you can find. Um, they may or may not work, and you're always taking them at your own risk. And so, sadly, these type of products have been involved in more than half of U.S. Poison Control Center calls, and this also involves children under 6 years old. So, children that drink these products or consume these end up having um, or end up becoming poisoned by the high amounts of caffeine. Another very risky high caffeine type of product is caffeine powder, and this is synthesized, and so this is how the powder looks like. And 1 teaspoon alone, and so a teaspoon is very small, is about 25 cups of coffee. And so one tablespoon, so a tablespoon is about 4 times the amount of a teaspoon, is a lethal dose for an adult. And so somebody can die because of that, because it's such a high amount. And so, but yet this product is readily available from tobacco shops, and you can easily buy it on the internet. And so this is not FDA regulated. Now, there is such a thing as caffeineism, which is basically a caffeine overdose. And this is a clinical syndrome. So this is at doses above 1,000 milligrams a day. And this is sort of like side effects of consuming caffeine for a long time, for a while. And this can lead to delirium, excitement, ringing in the ears, flashes of light, low-grade fever, chilliness, flushing, insomnia, irregular heartbeat, and loss of appetite. It mimics an anxiety disorder, but it is not like an anxiety disorder. So if you give a person a tranquilizer, they wouldn't even be able to respond to that. And so a way to basically reduce the effect of caffeineism, which is chronic use of caffeine, is just to simply eliminate caffeine. The mechanism of action of caffeine on our central nervous system is that it tends to block adenosine receptors. And so, if you remember, receptors are the ones that can bind onto molecules and send signals to our cells, and they send signals to neurons as well. And they can either tell neurons to fire more rapidly, they can stimulate them or depress them. In this case, adenosine, when an adenosine molecule, so an adenosine molecule is also a neurotransmitter. When adenosine itself binds onto an adenosine receptor, it tends to cause a relaxing effect. However, caffeine acts like an antagonist, and so it blocks adenosine from binding. And if you are blocking something that calms you down from binding, then that means that your body can't relax. You'll have more of a alertness type of effect. And so that's what caffeine does. It basically blocks the adenosine receptors, and there are different types of receptors that are found in the central nervous system. called A1, A2A, A3, and A2B. And as a result, when caffeine blocks them and adenosine can't bind, then the body just can't relax. It can't do its it doesn't have a sedative effect. It has the opposite effect. Adenosine levels usually increase during the day and exert a sleep inducing effect on the brain at night. And so caffeine promotes wakefulness simply by blocking those receptors. And not surprisingly, this also has an effect on the dopamine levels. And so adenosine receptors tend to interact with the release of dopamine in the prefrontal cortex, creating alerting and mild behavioral reinforcing effects in some locomotor activity. And so we know that when the dopamine pathway is activated, which is uh, the reward system tends to want to repeat that behavior over and over again. And so not only is caffeine blocking adenosine, it's having this effect on dopamine levels. Let's talk about caffeine use disorder. And so caffeine use disorder, and so this is a person who has basically like an addiction to caffeine, chronic use of caffeine, is recognized as a diagnosable condition in the DSM-5. And so this is a psychological book that can determine a psychological condition that a person has. And so a person who has, let's say, caffeine addiction has three of the most significant indices from the 9 criteria. And so these 3 criteria have to be present. And so the person has to have a chronic craving or inability to decrease or eliminate caffeine consumption, have a maintained use, or even after recognizing that caffeine has caused or worsened some type of mental or physical problem, and elicitation of withdrawal symptoms or the prevention of withdrawal by continued consumption. And so if a person falls under these 3 out of the 9 categories, then they are considered having a caffeine use disorder. People with caffeine use disorders also tend to have withdrawals when they're not using caffeine. And so some withdrawals may be irritability, headaches, loss of concentration, insomnia, and stomach pain. And this is when it's stopped abruptly. And so this is for a person who's constantly consuming and then they don't consume at all, they can have these side effects. You don't necessarily have to have like a chronic addiction to caffeine. This can actually be you can even feel some of these side effects even after drinking caffeine for just a few weeks. So, what are the treatments for caffeine chronic use? And so, a simple treatment, because there's no like pharmaceutical treatments out there. The simple treatment is just to basically gradually reduce off of caffeine consumption. And so you can slowly switch to decaf products. Like, for example, there's decaf coffee. And so you still get that taste of coffee that people crave, but you don't have that side effect of the caffeine. All right, now let's switch to the next drug that we're going to talk about, which is or tobacco products that contain nicotine. Nicotine is one of the 3 most widely used psychoactive drugs. It has like this double effect of being a stimulant and also a sedative. So some people will smoke to relax, to calm their nerves, while other people smoke to feel more stimulated, more alert. And so it can actually have both of those effects. And it's also one of the leading causes of disease and premature death in the United States. Around 2014, smoking rates started to decrease. However, 1 out of 4 people still consume nicotine through tobacco products. And it's also more widely used in youth. So when we say youth, this is like in maybe anywhere from like 16 to like 24, like pre-teenage years and early 20s. And so the types of tobacco products that are used in the younger generations are hookahs, e-cigarettes, and so these are electronic cigarettes. They don't have that really strong smell that natural cigarettes have, and so people have this belief that, oh, this is a more healthier way to smoke cigarettes, especially since they have different flavors, but it's actually very toxic and has led to a lot of different types of deaths. So it's just as bad as smoking regular cigarettes. And there's also this other type of tobacco product called snus or snooze. I really don't know how to pronounce it. My apologies. And so nicotine has been regulated simply because it is strongly linked to all kinds of different health factors, especially cancer. And so the government has imposed different types of laws. For example, the Family Smoking and Prevention and Tobacco Control Act, which basically has tobacco companies put warning labels on their products. And those warning labels let you know that when these products are consumed, they can cause cancer. And the age of tobacco has, excuse me, the age of people buying tobacco has been increased as well. And so before it used to be that as long as you're 18 and over, you can buy a tobacco product. But now that age has been increased to 21. And there's also other laws as well. And one of the more recent ones, which is the Center for Tobacco Products, NTSO, that basically is putting a regulation on electronic cigarettes because of its very strong side effects and also its popular use among young people. And so electronic cigarettes are basically cigarettes that are electronically manipulated. They heat up the nicotine and other chemicals that are in it. And so it's not just nicotine, it's also these different types of flavorings. And so they can taste like cherry, they can taste like grape, they can taste like all these other flavors. And that's what makes them so popular. And so electronic cigarettes, however, they contain potentially harmful ingredients. Like their flavorings, such as diacetyl. And so these flavorings are a chemical that has been linked to lung disease. And so not just the nicotine itself, but all of the products that are in it can contribute to lung disease. Some have formaldehyde, which is bad for you if consumed. Others have heavy metals like nickel, tin, and lead. And there's also ultrafine particles that can be inhaled into the lungs and they can attach to the lung tissues. And they can also contain other types of cancer-causing chemical agents. All right, let's talk about the pharmacokinetics of nicotine. So again, this is nicotine that is found in tobacco products. Sorry if you hear my dog playing with his toys in the background. All right, so moving on to nicotine. All right, so nicotine, here it is. Here's the molecule. It's the primary addictive substance in tobacco. It is colorless, volatile, in a liquid form, and it's not well absorbed from the digestive tract. In fact, people just inhale it, in order for it to be delivered to the body. And so it is absorbed from every site on or in the body. Okay. All right, let's talk about the pharmacokinetics of nicotine, and that is how nicotine affects our bodies. An average cigarette contains about 8 to 10 milligrams of nicotine, and only 20 to 25% enter the bloodstream, and this is when you smoke it. An average smoker, and so this is a person who smokes on a daily basis, absorbs anywhere from 20 to 40 milligrams a day. And a lethal dose is considered a 60 milligram dose all at once. And so to some people, even a 40 milligram dose has been deadly. All right, let's talk about the absorption of nicotine. And remember, we talked about what ADME means. And so ADME, so ADME, means absorption, distribution, metabolism, and excretion. And so this is how the molecule of nicotine is handled by our body and how it's metabolized and excreted. So the absorption, the amount delivered to the body depends on how the cigarette is smoked. And so, and it also depends on the control of the breath frequency, the inhalation depth, the time the smoke is held in the lungs, and the total cigarette smoked. And so you can have an increase of nicotine delivered to the body depending on how well you control any of these factors. Once the nicotine is entered into the body, once it is absorbed, then it is distributed to the rest of the body. And so nicotine is quickly and thoroughly distributed in the body to the brain, placenta, and all body fluids, including breast milk. And so this is for a female who's pregnant. The baby readily absorbs the nicotine and also can be found in the breast milk. Excuse me, I have kind of a cold, so my apologies. The metabolism, excuse me, And I just had the COVID vaccine a few days ago, and I have to say, uh, I had some pretty horrible side effects. Like I had a headache all day, I wasn't feeling good, and I developed some allergies out of it. I'm not discouraging anybody from getting the COVID vaccine. I'm just saying that I haven't been feeling too well these past few days. Anyway, back to our lecture. And so, nicotine is metabolized by the liver, and so 80 to 90% is metabolized before it is excreted by the kidneys, and it is metabolized by an enzyme. And so, what I mean by metabolizing is that the nicotine is broken down into smaller products that are no longer useful for the body. And when it is no longer useful, then it is excreted through the urine. And so the elimination or the half life basically of nicotine is about 2 hours for chronic smokers. And the major metabolite of nicotine is cotinine. And so this is when nicotine is broken down. And this is a marker for tobacco use and exposure to environmental smoke, which is excreted through the urine. Nicotine is very similar to acetylcholine. And we talked about acetylcholine, which is a neurotransmitter of the central nervous system. And acetylcholine basically stimulates the central nervous system. And so nicotine pretty much mimics that factor. And it specifically binds onto the nicotinic acetylcholine receptors. And so when it does this, it activates the central nervous system pathway, the pathway that is considered the sympathetic central nervous system, which is your fight or fight response. And it gives you that feeling of a lot of energy and a lot of alertness and wakefulness. And that's where nicotine gets its stimulant factor. And not surprisingly, this also activates the reward pathway. And so that means that it activates the dopamine centers of our brain. And this picture here basically are different types of nicotinic receptors. And all of these little green and orange and these different colored pictures are the subunits. These are the protein subunits that make up a receptor. Nicotine increases the dopamine levels of the mesocortical limbic pathway, which involves the VTA, remember the ventral tegmentum area, the nucleus accumbens. And so the VTA and the nucleus accumbens are the primary group of neurons that are basically linked to addiction and the feelings of reward in the dopamine pathway. And it also activates the forebrain, and so this is a prefrontal cortex, and so that also has an effect on on your motor control, and so it can make you feel kind of shaky and jittery. Motivation to smoke, basically the puff rate, is predicted by the dopamine release magnitude. And so people who have this craving to want to smoke and smoke and smoke over and over again basically are being driven by the dopamine reward system. So why do people smoke? What do they gain out of it? And so for some people, again, nicotine can act as a stimulant, and so it helps them become more alert and awake, and it has been linked to improved cognitive performance and arousal effects. And it also has been linked to cause like a therapeutic effect for people that have Parkinson's disease. And other people tend to use it as a way to just relax. And so that's the relaxing part of it. When you just inhale and exhale, it helps you sort of like calm your nerves. However, it just because it has these sort of effects, reasons why people like it in the first place, it doesn't mean that it's good for you. And so now we're going to talk about the acute effects on the body, and also the effects on mental health and, in general, the side effects of smoking or of chronic use. And so, some of the acute effects on the body are blood vessels that are constricted and in skin, and so that produces cold, thin wrinkles, and so faster aging. And if you notice here, twin A does not smoke, and twin B is a smoker, and so you can tell a noticeable difference that twin B tends to have more saggy, wrinkled type of skin. In some people, it inhibits stomach secretions, stimulates bowel movement, and so it's kind of like a laxative. And a person who is non-tolerant, I suppose, but it's just a typical side effect that it can be somewhat like a laxative. For other people, it may increase the metabolism of fat, and it also dulls the taste buds, and so it decreases basically your appetite. It can also slow stomach contractions and increases blood sugar, so that can contribute to diabetes. And it may improve attention and memory, although high doses may increase nervousness, tremors, seizures, and panic attack. It's been researched and known that people with mental health disorders tend to smoke more, possibly as a way to self medicate. And so, Americans with mental disorders account for 40 to 50% of all cigarettes consumed. And some of these disorders are drug and alcohol abuse, ADHD, bipolar disorder, antisocial personality disorders, and people who have panic attacks. And so my brother, he has he's bipolar and has antisocial personality disorder, and he is a very heavy smoker. And so I wouldn't doubt he smokes just to self medicate and calm his nerves. Unfortunately, with this increase in tobacco use, it also can contribute to schizophrenia. I'm not saying that everybody will have schizophrenia, but people maybe who are predisposed, it makes it worse. Same thing with bipolar disorder, depression, and some people may cause, or if you have a chronic tobacco use, will cause a nicotine withdrawal syndrome. There is little biological tolerance to primary effects, meaning that the body doesn't necessarily increase its tolerance. People tend to just dose themselves consistently with enough amounts to continue the effect of nicotine. And some people tend to become more easily addicted simply because of their genetic factors. And some of the side effects of withdrawal. So withdrawal means when you stop using the product, when you stop using the nicotine or the drug. In this case is irritability, anxiety, anger, difficulty in concentrating, restlessness, weight gain, and insomnia. And so that's why it's very hard for people to quit in general. And the severity of tobacco withdrawals does not seem to be related to the dose, duration of the habit, previous attempts at quitting, sex, age, education, alcohol, and caffeine use. Let's talk about the toxicity of nicotine. So, this is how it negatively affects our bodies in the central nervous system. And by the way, this is for chronic nicotine users. So, in the central nervous system, there's actually a loss of brain matter in the cerebral hemispheres, and so brain cells tend to shrink more. It has been linked to cardiovascular disease, which means heart disease. And so, nicotine increases a workload. Um, carbon monoxide decreases oxygen supply, so that means that there's more carbon monoxide present in the blood, and because of that, blood cells tend to bind to it instead of oxygen, and so now you have a decrease in oxygen in your body, which then increases arteriosclerosis and thrombosis in coronary and other arteries. This risk will drop if smoking has ended for 20 years or more, and so it takes a long time for a recovery after quitting. Smoking has also been linked to pulmonary disease, and that's one of the more common things that we know about smoking is that it can cause lung disease. And so the ash and tars are deposited on the membranes of smokers, and then therefore that reduces the actions of the cilia, which are these little finger-like projections in the lungs, and phagocytes as well that would normally clean the tissues. And so if there's no cleaning action in the tissues, then you just get this continuous development of tar in the lungs, and it makes it that much harder and harder to breathe, and that much harder to gain oxygen. And we know that we need oxygen to survive. It has been linked to cancer as well. 28.6% of all U.S. cancer deaths are related to cigarette smoking, and 22.9% of those are deaths in women and 33.7% in men. The major cause of cancer is to the lung, mouth, larynx, and throat cancer. Primary cause is bladder and pancreatic cancer, and it also increases the risk of cutaneous cell cancer. And I probably should have put this picture earlier, but here is an adverse effect of smoking. And so this is on the right, lungs that are filled with tar from cigarette smoke, making it impossible for the lungs to clean itself, and also very hard to gain oxygen. And all of these chemicals are like carcinogens, and so that can also contribute to cancer. Now, passive smoking, which means secondhand smoke, can also be just as detrimental. And so basically, passive smoke is non smoker. So you're not a smoker, but you're exposed to the toxic agents in cigarette smoking. And so this is what people exhale into the environment. And so that's why cigarette smoking is banned indoors. I mean, not at your home, but in public areas because of the secondhand smoke effect. And just like a primary person, the primary smoker, the secondhand smoker is also at risk of lung cancer, coronary heart disease, chronic obstructive pulmonary disease, and clogged arteries. And it affects have been global, worldwide. So 1% of deaths in 2004 have been linked just to secondhand smoke. And this has also caused an increase in asthma, bronchitis, and pneumonia. And especially a child who is increased to secondhand smoke has a greater likelihood to pick up smoking themselves. Secondhand cigarette smoke is also very detrimental to a baby, and so technically the baby is kind of like at secondhand just because the mother is inhaling the smoke. And smoking is very detrimental to the fetus. It can cause very serious birth defects, especially the reduction of oxygen, and so this is called fetal hypoxia. And so if the baby is not receiving enough oxygen, that can also lead to death. And there's also an increased risk for premature babies being born. Now, there are pharmacological therapies for nicotine dependence. And so these are strategies for people who want to quit smoking. And quitting, at least with cigarette smoking, can be very difficult. And so, in fact, it's not too successful depending on how uh, addicted the person is, like how much of a chronic use they've been using it for, because it has not just the uh, withdrawal symptoms; it's also a psychological association when a person smokes, and so it can cause some type of psychological therapy for them. Maybe it relaxes them. Maybe it became a habit. There are many reasons why a person can become strongly addicted to a drug like nicotine. And so, some of the pharmacological therapies are nicotine gum, lozenges. It's like candy that contain nicotine. And so, all of these contain nicotine in low doses. And those tend to be more effective than having some type of antagonist, which basically blocks the ability for nicotine to bind onto your receptors. So these are more of like agonists. These are low doses of nicotine. That just helps a person kind of wean off of smoking without having these crazy increases in withdrawal symptoms, because withdrawal symptoms will definitely cause somebody to relapse. And so, nicotine replacement therapies, we said nicotine gum, lozenges, inhalers, mouth spray, nasal spray, transdermal nicotine patch, which you put it on your skin, orally dissolvable films, and low nicotine cigarettes. And non nicotine replacement agents can be something like an antidepressant, because some people kind of develop depression, from smoking for a long time, just because of the way that it affects your central nervous system. And also, it acts sort of like a partial agonist for nicotine, and so that means that the nicotine can't easily bind onto the receptors. Only a small percent of smokers, unfortunately, achieve permanent abstinence. And so, tobacco dependence treatment successes depend on how long they've been in treatment. And so, for people who have been in treatment for about a year, 22% of them tend to succeed and permanently stay off of tobacco products. Unfortunately, some tend to relapse within a year, and that's about 90% of people, which is kind of crazy, but yep, it's an unfortunate side effect of tobacco use. There are also partial nicotinic receptor agonists, meaning that they partially act on the receptors. And so this is to reduce withdrawal symptoms, but block nicotine from binding. And these, unfortunately, are not as effective simply because a person doesn't gain any like pleasure, I guess, out of it. And so they don't tend to stick to the use of it just because they don't feel anything, from it. And so one of these pharmaceuticals is called Chantix. And so it basically partially blocks the nicotine from binding onto the receptors. And interestingly, there's also a vaccine therapy. I don't know how effective this vaccine therapy is, but I found it interesting that there's even a vaccine for it. And so, nicotine bound to antibodies prevent basically, well, the way this therapy works is that nicotine will bind onto the antibodies. So, your antibodies are part of your immune system. And once it binds onto it, it prevents it from crossing the blood brain barrier. And so, if it's not crossing to your brain, then it has way less chances or none at all to induce the reward pathway, so the dopamine pathway. And we know that the dopamine pathway is the reason why people tend to be addicted in general to drugs. It's that motivation reward system, the thing that you want to do over and over again. So if you're not activating it, then you're less likely to have those cravings. But the results are not promising, and I personally don't know enough information about it, but I'd like to look more into it. I think it's pretty interesting. All right, so that concludes our lecture. Let me know if you have any questions by emailing me or by coming to my office hours.